Bronchiectasis. You may have never heard of it before, but bronchiectasis is one of the most common chronic respiratory diseases. It's a condition where the airways in your lungs become damaged and inflamed. You can get it at any age, although it's found most often in older people. You can have just bronchiectasis, or you may have it along with another prolonged respiratory illness, like COPD or asthma. The symptoms usually include a chronic cough with a lot of mucus. You might also be short of breath or wheeze when you breathe. You may have lost weight or be more tired than usual. All this can make bronchiectasis tricky to diagnose, since similar symptoms can be caused by other conditions. That's why doctors need a CT scan of the lungs for an accurate diagnosis. Getting a diagnosis as early as possible is really important, because starting appropriate bronchiectasis treatment quickly can help fend off what's known as the vicious vortex. So what is the vicious vortex, and what causes it? The thickening and scarring of the airways that happens with bronchiectasis makes it easier for mucus to build and stick in place. The stagnant mucus traps bacteria, which makes you more susceptible to infection. Infection causes inflammation, which triggers more mucus production and thickens the airway walls even more. The excess mucus clogs the compromised airways, paving the way for another round of infection, inflammation, airway damage, and, eventually, loss of lung function. That cycle is called the vicious vortex for good reason. It continually feeds itself, causing permanent damage and making your disease progressively worse. That's why it's so important to follow your doctor's treatment plan carefully. Your doctor may prescribe treatments such as inhalers, nebulized medications, antibiotics, PEP devices, and pulmonary rehabilitation. It's important to work with your care team to make sure your treatment is doing enough for you. Because if treatments aren't controlling mucus buildup and infections, the vicious vortex can set in. Nobody wants that to happen, and it doesn't have to. That's where HFCWO therapy comes in. HFCWO stands for High Frequency Chest Wall Oscillation. It's an airway clearance treatment you do at home by wearing a therapeutic vest, such as the VEST APX System, for a short time every day. The VEST APX System is made to be comfortable and simple to use, so doing your therapy exactly as the doctor prescribed is easy. During a treatment, the VEST system gently compresses and releases the chest wall. That increases airflow and creates oscillations which thin and loosen the trapped mucus, so it can move up through the airways where it's easier to cough up and out. The extra airflow and oscillations allow air to move past the trapped mucus. That can mean fewer infections and less use of antibiotics. It can mean you have fewer flare-ups that can land you in the hospital. It can mean preserving your lung function so you can breathe easy and do the things you enjoy. Once you've got bronchiectasis, you're always going to live with it. But the right treatment can help you keep the vicious vortex at bay and live your best life.